All right, welcome back to Between Two Coupons with your host Skids.
Ew.
Ew.
D Hum 39 Escobar.
Greg Shard, I am 40. And this is continuing our Men's Health Month, second half of the year, actually, series. And we are getting into preventative screenings and things that a lot of F3 PACS members should know about and consider doing if they're not already with their primary care physician or specialist like we have here today. So, D, you want to go over disclaimer here?
Yeah, so obviously, guys, this is F3 Fitness Fellowship and Faith. And in that, the fitness piece, right? We know that men's health is super important to us. We also have 5 core principles. We are open to all men. We are free of charge. We're always outside. We're led in a rotating fashion, and we end in a circuit of trust. But I think what's most important is our disclaimer, and that is we are not professionals. And so this is just us having a little bit of fun, and hopefully, our ambition is just to reach one person and get somebody motivated to think, feel, do, or say something different as it relates to their healthcare. So why men's health? So in 2023, we have been focusing on creating awareness around men's health for our PACS of Omaha. And we recently did a really very scientific study that had probably some around 30 or 40 responses. And what we learned from our community of men is that only 2 out of 3 of you have a primary care physician, meaning 1 out of 3 of us do not. And knowing that this group is for all men, but most of our members are somewhere between 30 and 60, we recognize the importance and impact of really just being a good steward of your health, and what that means to you, what it means to Centrica, your family. And so we've dedicated this year to really focusing on topics that matter to us. We'll be talking about oral care and dental care. We'll talk about primary care, prevention, mental health. We have a topic on that coming up. And then most importantly, we'll be talking about screenings. And so today we'll be discussing prostate cancer and urological healthcare. And with that, Greg's going to introduce our guest.
Yeah, and while we aren't professionals, we try to bring some professionals on with us. And today, thanks again, Dr. Garrett Pullman, for coming on and hanging out with us for a few minutes here and talking about what he does and why it's important to men's health. So, Dr. Pullman, thanks again for coming on. If you want to introduce yourself and maybe go through some of your background, if you could.
Well, thanks again for having me, and I think it's great what you're doing with your group and YouTube channel, and thanks again for having me on. So again, I'm a board certified urologist. I practice out of Kearney, Nebraska. Grew up around Norfolk. And as far as doing medical training, I did my undergraduate at Lincoln at UNL, went to medical school at UNMC in Omaha, and then went on to do a residency in urology, which at the time was 2 years of general surgery and 4 years of urology training. So 6 years of surgical training before getting out and practicing. And so I've been out in Kearney practicing for the last over 8 years now. And so it's a great community, and just love being able to serve the community and its urologic health there.
Thanks for that, Dr. Pullman. Do you want to go by Garrett on our interview here, or Dr. Pullman, or DP? I don't even know if it was any shorthand here.
Whatever you care to, any sort of gibberish, my way will work. So,
well, I did. I feel like there's one thing in your background you forgot to mention. I know you were a part of a fraternity at Lincoln. I think it was the best fraternity in Lincoln. What was that one again?
Farmhouse. Yeah.
Farmhouse. Okay. I know that we have some SIG subscribers. I just want to make sure they knew. Well, thanks again for that. I didn't know you had so much training as a urologist. Actually, I didn't realize there was a couple surgical years in there, which kind of makes sense. But so you're able to do what are the most common procedures, I guess, that you see? Or I know you're pretty much at the forefront of some things out there.
Yeah. So as far as urology, we deal surgical issues pertaining to the kidneys, the ureters, the tubes that drain the kidneys, the bladder, the prostate, as well as many other issues in men's health, including testicular cancer, anything related to erectile dysfunction, low testosterone, penile cancer. So really anything related to the urologic system or tract, we do. Some of the we kind of run the gamut as far as all the different procedures that I do. I really specialize in a lot of prostate health, but like I said, we treat many conditions. We treat men and women with kidney stones. And, that's one of the more common procedures we do is treating kidney stones with a laser or with an external shock wave to break up the stones if they're not able to pass the stone on their own. I treat a lot of prostate cancer. One of the procedures that I perform is a robotic assisted prostatectomy, removing the prostate and lymph nodes robotically. So it's less invasive approach to removing the prostate. And but I do try to stay on the forefront of some of the newer technologies. We treat a lot of men with enlarged prostate. Been kind of one of the first to market on a lot of the new technologies, including in our area with a UroLift procedure, which is an option to open up the channel, allow men to empty their bladder more freely, relieve some of those symptoms of an enlarged prostate, but do so in a minimally invasive fashion, typically in the office setting. There's also a newer procedure that we actually do in the hospital called aquablation. So we're using a high pressured water jet to open up that channel to help men alleviate a lot of those symptoms of an enlarged prostate that's causing them trouble, again, for that benign, non-cancerous enlargement of the prostate. We do some pediatric procedures, circumcisions, hypospadias repair in kind of the more straightforward cases, undescended testicles in kids. So, there's just a wide variety of procedures and technology, and that's kind of what got me into urology was the technology, but also unlike some surgical specialties where treat the patient, you may never see them again. There's a lot of conditions in urology that do require a lot of long-term follow-up. So I enjoy that part of it as well.
That's pretty wide variety of things. I didn't know it was such the breadth of your field here.
Right.
What Dr. Pullman, when we get into this a little more, what are like we started with, our group ranges anywhere from 20s to 70, but the core group of guys are probably in that 35 to 55 range. What are some of the most common things, I guess, you see of that wide range that you do treat of that you see guys come into or seek attention, I guess, first of all?
Well, I think when we talk about, to back it up a little bit, when we talk about screening, especially, some of the members don't have a primary care doctor yet. That's where I think it's important for them to have one, because in that age group, you should all already be thinking about prostate cancer screening. So some ask, well, what age does that start? Well, if you're at average risk, that is already at age 45. So that's coming up for a lot of men in your group, and maybe already has been. And hopefully they've already started with that with the primary care provider, including a PSA or a blood test called prostate specific antigen, which is kind of a good check engine light for men in their prostate. See if we need to worry or not, or can we just keep watching that number along with the prostate digital rectal exam to make sure there's no nodules, no lumps or bumps. Now, if a man is at increased risk, that starts at age 40. And so some of those factors include pretty suspicious family history of prostate cancer, African-American, any history of germline mutations, or increased risk for prostate cancer. That's age 40. So I think that number keeps shifting, mostly because we know that prostate cancer is very common. 1 in 8 men can develop prostate cancer. And the important thing is detecting it early. If prostate cancer is detected early, the survival rate at 5 years is nearly 100% survival. Whereas if it's detected late, prostate cancer is already spread outside of the prostate, that drops down to only 28% survival at 5 years. So that's where I think early detection is key. Some of the other conditions that we see men commonly in this age bracket include, and it's Men's Health Month, so I think it's appropriate to at least bring up low testosterone. So a lot of men in this age bracket can have low testosterone. Some of the symptoms may include fatigue, decreased sex drive, difficulties with erections, decreased muscle mass, increased obesity, and those all could potentially be a sign that you have low testosterone. So that should definitely be on kind of something to be thinking about with your primary care provider, at least asking and screening for low testosterone. With that being said, I do kind of, want to make sure that men are aware that there's a lot of low testosterone clinics that are kind of more of these for-profit testosterone clinics that may not have the experience in individuals running those clinics. And so, there's other things to think about. And that's why I think it's important to make sure that, definitely start with your primary care provider, but make sure you get to a trained urologist that knows how to properly manage those conditions and is not just, trying to sell you some hopes and dreams. And because there are some important things to think about, especially for men considering taking testosterone replacement therapy, especially if they're still considering maybe having kids, and so that's one thing that taking testosterone can really suppress the intratesticular testosterone and affect fertility down the road. So you want to make sure you're not burning any bridges by taking that and not really thinking about some of the consequences that it may have on your health. But some of the other conditions that we commonly see men for and include vasectomy. So that, again, this age category, a lot of men are thinking about vasectomy. And I always kind of ask men that are coming in my practice to get a vasectomy, how many kids do they have? And here in our area, it seems to be 2 to 3 is kind of the magic number to think about. So, and there's a lot of kind of myths about vasectomy. And we actually have an episode on my podcast, the Prostate Health Podcast, about the myths about vasectomy. And it would be a good one to check out. So, but yeah, those are some of the conditions we treat. And hopefully that some of this information can kind of help out your members and get them in to see the right providers for sure.
Hey, this is a really good segue. And as you talked about prostate cancer, vasectomy, and low T, these are mission critical topics for men in this age demographic. But we know that one of the purposes for this discussion is to have a conversation, right? And to maybe help with maybe the stigma associated with seeking care and screening and all these scary things that may become of the end result of probably a negative exam. But I'm kind of curious from your vantage, like, how would you encourage men in this age to go seek care, or any words of wisdom for folks to maybe not maybe be associated with the stigmas and just kind of move past it?
Yeah, and I think that with education, like what you all are doing with your YouTube channel, I think we're helping to reduce that stigma, and I think more and more men are being more proactive about their health, and I think that's important to make sure that they are seeking at least an annual checkup, because there are certain things that having a primary care provider that they can do to screen for some of these conditions, because many men develop some of these conditions early on, in their 30s or 40s or 50s, and they may not even be aware of some of the consequences of having some of these that it can have on their health, and may not show up until their 50s, 60s, and 70s, but at that point it may be too late. So I think it's important to be proactive about your health, because it can really save you a lot of headaches down the road.
Yeah, thank you for that perspective. Hey, you mentioned some of the myths around vasectomy, and I love just the reminder and reinforcement that June is Men's Health Awareness Month. And so, what are some of those myths around vasectomies that you're like, hey, if you're 40 to 50 and you're seeking answers here, what are some things that resonate with you?
Well, I think that, some men think that a vasectomy is going to cause prostate cancer. It does not cause prostate cancer. And we have data that supports that it does not, in our guidelines to support that. So some men think, well, I'm going to tie my tubes off, my testicles are going to explode. That's not going to happen either. And, some men think that, okay, so I'm going to get a vasectomy. I'm not going to have any testosterone. It's going to affect that testosterone. That's not the case either. That's a myth as well. Some men think, well, I'm not going to see any fluid come out. That's also a myth too, because the testicles are just one source for the fluid that comes out in the ejaculate. And so you will still be able to have an orgasm, see fluid come out. It's just not going to have the swimmers in it.
Yeah. So guys can't make their balls bigger by getting a vasectomy.
Correct.
Not going to work. Okay. A couple guys asked about that. Just got to get that pull out there.
So as I think about like this, just the notion around screening awareness and the responsibilities we have at home for just self-care, like what recommendations do you have for men at home? Like how should we be screening ourselves, or at least being attuned to the way our body's showing up.
You bet. Well, kind of going back to, we'd mentioned testicular cancer is another kind of men's health topic. Men should definitely be aware of their testicles, be performing at least a monthly exam on their testicles. If you feel any lumps or bumps, any firmness, any nodules, that's definitely a sign you need to get in to get checked out by your primary care provider. When we talk about things that are healthy for your health, from a urologic perspective, definitely from prostate health, kind of what I tell patients is what's healthy for the heart is healthy for the prostate. So anything that you're going to be doing to drive that blood pressure down, to drive your cholesterol down, decrease your waistline, those are all things that will be helpful, not only from potentially better outcomes down the road when it comes to prostate cancer, but also enlargement of that prostate and potentially even decreased symptoms of an enlarged prostate by really maintaining and improving upon your health. And we actually have some dedicated episodes on the podcast, including episodes 59 and 80, where we bring actually some of the experts in the world on kind of what's healthy. What are some of these things we should be focusing on for prostate health, but also can be overall good to your cardiovascular health and your overall health as well.
Yeah, and for guys watching this, we're gonna link in his podcast as well as some of those episodes, just so you guys have the ease of finding those. But so we talked about kind of at home screening, but say somebody comes in, they get referred, they go to the primary care physician, our first step, right? They get screened, they say, hey, I think you need to make an appointment with a specialist, get this, double checked out. Maybe the lab's a little high. Like, how does a patient typically get referred to you? And then what does that look like when they come in for maybe that enhanced screening that you would do?
So in terms of, getting referred to a urologist, that, oftentimes is referred by your primary care provider, because they're the ones that, check some of these initial labs, say, for example, your PSA test, the blood test for screening for prostate cancer. And, they'll refer all those records to us, and then we can kind of get things set up to see us. You don't always necessarily have to be referred to see a urologist. We have a lot of self-referred patients come in to see us as well for some of these various conditions we talked about. Let's say, for example, you come in for an elevated PSA level. Typically what that consultation is going to involve is, a discussion between the urologist and the patient regarding, what that level means, as well as what's for some of your options at this point. In our practice, typically we like to get more information first. Includes a physical exam, checking that prostate exam, family history, going back through all your old records, looking at previous labs that you've had in the past. But for a guy with an elevated PSA, one of the options is to get more information with additional testing before we go right on to a biopsy. So there's different kind of what we consider prostate cancer biomarkers that will give us more information that will guide us in terms of maybe whether or not we do need to consider a biopsy versus maybe just continuing to watch that number. We're also incorporating MRIs of the prostate as well. For those guys with an elevated PSA, we have the technology now to do some targeted biopsies, not just doing just the random sampling of that prostate, which is typically a 12-core biopsy. But in addition, if there's any spots on that prostate, we can have the technology now to target those areas, because especially if we can find that the prostate cancer is localized to that one area, we even have options to maybe avoid radical treatment, where we're treating the entire prostate with the radical removal or radiation, maybe even just like we do for breast cancer, hone in and just treat that area that has the prostate cancer with either IO therapy, where we freeze that area, or high intensity frequency ultrasound to treat that area to minimize some of the side effects that come with radical treatment.
Yeah, super helpful. I was thinking, Garrett, as you're taking us through all this information, this is certainly the information age. We have all types of information at our fingertips, and sometimes misinformation. As a provider, do you have a recommendation for men, and as they're looking for information and they're seeking to understand what's going on, where should we be looking? Who should we be talking to?
Yeah. Well, that's the thing I do counsel patients on, is that there's a lot of false information on the internet, including YouTube. And there's been some studies that have shown how prevalent that misinformation is. And so that's why I think it's important to make sure that you seek, help from a trained medical physician, especially in that particular area. As far as when we talk about, prostate cancer, there are some more trusted information on the website, including the Prostate Conditions Education Council, the Prostate Cancer Foundation. Those are, Zero Prostate Cancer Organization. Those are some of the more trusted websites. And that's one of the reasons why I, generated the Prostate Health podcast, to make sure that we can get accurate information out there to men, not only on prostate health. We have a lot of episodes on erectile dysfunction, low testosterone, Peyronie's disease, which is penile curvature with erections. And these are episodes that we bring in experts within the field on each one of these topics to really get the right information to these patients. We've also started up an academy as well for men wanting to dive in even deeper to some of these prostate health issues, called the Prostate Health Academy. And that's just another option for men to get more information, but also to interact with like-minded individuals, including direct access to myself as well.
Oh, that's tremendous. And folks, you heard Skids mention earlier, you'll find the links to the podcast in the description in the video here. Let's dive in deeper to prostate cancer. Can you maybe take us through, like, how does it present? What are the symptoms? What are the causes? And then maybe just a little bit of diagnosis and treatment.
Yeah. So that's the thing, is prostate cancer typically doesn't present with symptoms until it's too late. And that's why it's so important to make sure that screening is going on. Some of the symptoms of more advanced prostate cancer could include blood in the urine, bone pain, weight loss. But again, that's, past the point of, where we want to be, and we want to be able to detect it much sooner. And so that's why, the PSA is so important that we have that now, along with some of those additional tests that we have now, that once you know that the PSA is elevated. And then we talked about some of the targeted treatments available if the cancer is localized. We have a lot of guys that we perform active surveillance on as well. We do a good job of trying to risk stratify men and putting them into a risk group that we have found that in the past that there are some men that we were over-treating. And so, we try to do a good job of stratifying guys to figure out what's going to be their best option for those guys with more higher risk, unfavorable risk disease. We talked about radical removal of that prostate, or radical radiation, where we're treating that entire prostate with radiation, either with external beam radiation therapy or radioactive seeds or pellets within that prostate.
What are some of the things coming down? We're in a pharmaceutical company. We hear about pipeline all the time. So, like, what do you see, whether it's surgically, methodology, or drugs that you see coming down in the next 5 to 10 years to help you advance your practice even more?
Yeah, well, and that's the thing, is that it has been an exciting time for the treatment of prostate cancer, especially when we talk about advanced prostate cancer, and that's the cancer that prostate cancer is already spread outside of that prostate. And historically, all we've had is androgen deprivation therapy, which has been awesome to have, where it suppresses the cancer and gives guys more time. Well, the cancer can sometimes get resistant to that therapy as well. And we've got, just new treatments that focus on the androgen receptor to also, to try to trick the prostate cancer to really give guys more time. And, there's just, bone targeting agents that we have coming down the pipeline. It's just an exciting time for prostate cancer because we do have these new options, more tools in our tool belt for sure. But again, it really we have to go down the line of, okay, where are we at with it? What's worked, what's not? And, but again, that's why it's important to get to a specialist that is trained in those areas for sure. And, I just wanted to let you know, this might be a time to edit, but I don't know how many more questions. I just realized we were coming up on the 2:30 mark, and I do have to go run and grab my kid, but I didn't know if we were kind of wrapping up here.
Yeah, like Escobar, what do you got a couple of wrap questions? You're always good at that too, and we can.
Two questions for you. The first is we haven't really talked about just a screening process, but what can men expect for screening, and then maybe any last closing thoughts for us
in terms of expecting of screening, or as far as like the PSA or the
blood test, the physical part. Guys get a little nervous on that.
Oh yeah, gotcha. Okay, all right. All right. And then what was the second part?
Any closing thoughts?
Okay, perfect. So, excellent question. Again, in terms of, men can be kind of anxious when it comes to screening for, the exam part. And, and that's why I think when we go in to see a provider that, these things are important though. And so we talk about the one component being the blood test, but also the prostate exam. And, what's involved with the prostate exam is it's a rectal exam. So it can be slightly uncomfortable, and, men aren't lined up at the door to get that test done, but it does give us more information because the prostate itself should feel nice and smooth. We shouldn't feel any nodules, no lumps or bumps, no firmness on that prostate. So again, it does add more information to that exam that, had we not performed it, we wouldn't get that information that can kind of help guide you in that process. So again, blood test, the rectal exam, but also some of the additional tests and more specialized blood tests that can give you more information, or whether or not you need a prostate biopsy, because that's, again, how the prostate cancer is diagnosed, is on a biopsy, but also more imaging tests such as the MRI. But as far as closing thoughts, again, want to thank you both for having me on the show today. And it's a pleasure to be able to talk about men's health and prostate health in particular. And really appreciate what you are doing with your YouTube channel and your group. That's great. So I look forward to seeing more down the road coming down the pipeline from your group.
Thanks, Dr. Pullman. And what's your podcast name again? And just so we have that on the minds.
Yep. So it's the Prostate Health Podcast, and you can find it at theprostatehealthpodcast.com or wherever you go and listen to podcasts, at Spotify, Apple Podcasts, or my YouTube channel. So, but yeah, I'd love to have any listeners join in, and definitely make a comment in on the YouTube channel too. I'd be more than happy to answer any questions.
Love it. Well, thank you for your time today. This has been super informative. And guys, you heard it from an expert, and we'll continue our conversation on men's health. So with that, thanks for tuning in.
Yep. Thanks again.
Thank you.